In the wake of last week's public admission by Mount Carmel Health System that a doctor had ordered excessive, potentially fatal doses of pain medication for patients, the search is now underway for answers.
It's a story that triggered memories for many families and may make you wonder what more you can do to protect yourself and your loved ones while they're in the hospital. NBC4's Ted Hart talked to a professional patient advocate today and has that story. Ted?
Yeah, when you have to go to court, it's a good idea to have a lawyer to look out for your best interests, and you can make the argument that when you go to the hospital, it's a good idea to have an advocate, whether that's a family member, a friend, or even a professional.
In the stress of a hospital environment, trying to understand information and make decisions about your condition or that of a loved one can be challenging.
I always encourage my clients to kind of hit pause.
Dr. Annette Tecoris gave up her medical practice to become a private patient advocate, someone to help you understand what's happening and make decisions.
Two people sitting in the same room hearing the same speech by a doctor, and one walks out and thinks they have 3 months to live, and the other one walks out and said, no. He said, in 3 months we're going to reevaluate if the treatment is working.
Nobody could give me any answers.
Christine Allison says when her husband Troy's condition was rapidly deteriorating at Mount Carmel West Hospital last summer, she called her daughter to the hospital.
And she's the one that asked a lot of the questions. And we were getting different answers.
Troy Allison died that day, and Mount Carmel recently informed Christine that her husband was one of at least 27 near-death patients who were given excessive and potentially fatal doses of pain medication. Mount Carmel says the families of all of the victims had requested that life-saving measures be stopped. Dr. Tecoris worries that the Mount Carmel case will make it harder now for patients and loved ones to make end-of-life decisions.
My greatest fear out of all of this is that comfort measures only or do not resuscitate people will start to question whether or not they can trust that those orders will be carried out, because comfort measures only, do not resuscitate, does not mean to over-medicate someone.
And Dr. Tecoris says she's not aware of any other independent patient advocates in Central Ohio. She says hospitals have patient advocates in-house who can help, but she says they are employees of the hospital. Local for you, Ted Hart, NBC4.
All right, Ted, thank you. The investigation and number of lawsuits continue to grow into what reportedly what happened inside Mount Carmel West Hospital. Right now, 3 wrongful death lawsuits have been filed against the Central Ohio doctor and Dr. William Husel. Both the hospital and lawsuits allege that he gave 27 patients deadly doses of pain medicine, and in some cases that included fentanyl. Mount Carmel has since apologized and removed nearly 24 support staff from patient care while it investigates what exactly happened. In the meantime, the hospital has established a hotline for any family members who may have questions or concerns.
Now, Storm Team 4 with Central Ohio's most accurate forecast.
We had a blast of winter over the weekend and some cold air to follow it this morning.
Great news for cold weather lovers, our skiers and snow.